Testing for COVID before procedures is really kind of a new necessary. The more we learn about the virus, the more we recognize that people can feel okay and not have any issues and yet be infected with the virus and therefore put others at risk. So before we come to the operating room to experience general anesthesia, and then maybe even after anesthesia and the operation, become admitted to the hospital, it's necessary to know, for the sake of all the staff as well as the other patients in the facility, and certainly each individual patient getting tested, what their status is as it relates to COVID positivity. Screening questions as well as a temperature check are necessary because some of us may not consider ourselves having put ourselves at risk, but there are a select set of questions that are quite simple that do identify potential risk, specifically, as it relates to travel or even sick contacts. And then temperature is important because the slightest variation in a temperature from normal may be the only clue that we have, coupled with maybe a questionnaire that might lead you or anyone to suspect that there could have been a COVID exposure leading to COVID infection. Everybody is screened: patients, family members in certain circumstances, teammates, everybody, physicians, nurses, techs, it doesn't matter, administrative staff, everybody gets screened prior to allowing access to the hospital on a daily basis. Yeah, that's an excellent question. I just had office today, as a matter of fact, and had this discussion several times, as a matter of fact. As you know, patients are now sort of more interested in re-engaging the opportunity to have some of their medical concerns addressed. The question of hospital safety as it relates to each individual patient comes up. What I have said to the patients that I've encountered who've asked this is simply that we, as a hospital system, have gone through every measure to ensure that the hospital is as clean as possible, surface areas are as clean as possible, hand washing, universal masking. All these precautions are in place. Social distancing as it relates to avoiding large gatherings within our facility. We are screening to ensure that every opportunity to catch a high risk event is made, and we're also using extraordinary precautions within the operating room to ensure that the operating room itself is as an environment is as clean as possible.